This is it. It is our final lecture for this term, Week 8, Lecture 3. Let's briefly talk about applied research. So, applied research is the kind of research I do. It's actually research to solve practical problems. So compare that to basic research, which is another major type where you're conducting research specifically to test theories. So the research I do is trying to solve problems, save lives, reduce infections, that kind of stuff, as opposed to just sort of like testing theories of things. So there are studies that do both. So for example, looking at studies on depression and drug research, an applied study might look at the effects of medications on depression, and then a basic study might look at brain function among depressed people to find those differences, right? So the basic study again is looking at theories, causes of things. The applied research is trying to reduce depression. So why would you conduct applied research? Well, the usual reasons. You want to describe some sort of phenomena, whether it works. You want to be able to predict phenomena, or you want to be able to evaluate phenomena. There are two fields of applied research we'll talk a little bit about. There's actually a lot of them. One is human factors research. That looks into improving human technology interactions in contexts. And the other one we'll specifically talk about is evaluation research, which is determining the needs for programs and whether they were effective and whether they're implemented, that sort of thing. That's evaluation research. So human factors research, again, is the study of human technology systems. So for example, checkout scanners and cashiers. For years, checkout personnel were getting wrist injuries because of the scanners only scanned on the bottom, and so they were always flipping things and getting wrist injuries. So if you note now when you go to the supermarket, they have a scanner both on the bottom and on the side, and that's so they don't have to flip it, and that was discovered through human factors research. That was a way to reduce injuries. So there's automobile designers, think of Volvo. So Volvo did a lot of human factors research. It's why their cars are so safe. And when you open the door, they even have lights on the back of the door there that face traffic so they'll see you. So the goal of Volvo's research, their design work, is to reduce injury to passengers in the case of crashes and also reduce crashes, period. So Google Cars is another human factors research. They look at how people interact with autonomous vehicles and autonomous vehicles interact with people in the real world. Not always great. So they examine specifically three different parts of the system. They examine humans and machinery or tech, and they also look at the environment in which those things meet. So they study 5 types of human errors. So we're going to use test taking as an example. They look at errors of omission. This is when you're looking at steps for a process. They do not complete an important step. So this would be forgetting to bring a writing tool, for example, if you're taking a pen and paper test. Errors of commission are another type of error where you perform a step but you do it incorrectly. So, for example, selecting more than one answer choice for a question is usually an error of commission. You've done a step, but you did it incorrectly. You can also have errors due to extraneous acts, so distractions, for example, or being too tired. So if you stayed up late, too late studying, you've ended up falling asleep during the test, that would be an error due to extraneous acts. Then there's sequential errors where you do the right processes, but you do them in the wrong order. So that'd be like answering a question before you read it, then reading it, I guess. That would be the sequence is wrong. And time errors. So time errors is when you incorrectly pace. So this is one of my problems. You spend too much time answering one question, for example. That would be a time error. So they break systems down into steps, and in each step they look at the potential errors that are made, and they try to come up with ways to reduce those errors, and that's basically how human factors researchers solve problems practically. So there are 5 general strategies for human factors researchers. There's observations of real life working systems. They can also go out and do field studies of systems under operation and control conditions. They also do simulations of things. laboratory experiments, and finally just straight up mathematical modeling on the computer, trying to determine how things will work out mathematically using computer models. So evaluation research is the other type of applied research we want to talk about. And this is program evaluations. So we use statistical and research methods to evaluate programs, their need for them, how they're implemented, whether they're effective. So for example, does providing recycling bins to residents actually increase recycling? That's a question. For many of us, as your normal trash can gets more and more full, what you deem recyclable becomes sort of wider and broader and more liberal because you gotta get rid of stuff. But when they initially introduced recycling bins, you used to have to take off the labels and wash everything out. It was a real pain in the butt, and people didn't recycle. So someone did an evaluation study where they said, well, what if we just give them a big blue can and they can throw everything in there, and we pay people down the line to actually do the cleaning and taking the labels off and whatnot. And people started recycling a heck of a lot more. That was an evaluation research where they found the program wasn't working that great, and they found a way to improve it. How about carpool lanes? Do they actually result in more carpooling? It's questionable, but an evaluation research study would actually help answer that. So there are different types of program evaluators, like who's going to evaluate the program. You can have in-house ones, so people who work for the organization that runs the program, and they tend to be biased, right? They work there, they want to find that the program works. But there's an easy learning curve for them. They understand the data that's available. They understand what the program is supposed to do better. So that's one of the benefits of in-house evaluators. And then there's consultants or outside evaluators like the Bobs. So they tend to be more objective, except they're still getting paid, right? And in addition to that, they have a steeper learning curve, and it's harder for them to communicate because they don't understand sort of the details of things. They have to learn all that stuff and catch up. There are also two general categories of program evaluations. There's formative evaluations. The purpose of these generally, there's several different types, is to improve program quality. And then there's summative evaluations. Sum is sort of like, you're adding at the end. And these are global judgments about program quality. So we're going to talk about ones that are under each of these general categories. So there are 5 specific types that fall under those 2 categories of program evaluations. There is needs assessment, evaluability assessment, which I swear is a made-up word, program monitoring, program impact, and efficiency analysis. So let's talk about each one of these in a little more detail. So needs assessments are conducted before a program is actually created. It's where you try to identify what are the unmet needs that we want to meet with this program. What's the scope? What are the objectives? Do we even need this program? That is a needs assessment. So, for example, someone might do a needs assessment of whether we need tax breaks to encourage there to be more kindergarten through 12th grade teachers. In them, you define what is the target population for this program, what is the extent of the services we're going to offer, what are the areas that are most in need of the program. If you do a good job anyway, you compare alternative solutions to the identified problems, like this versus that. Several sort of proxy analyses of what would be the most efficient. And so the end result of a needs assessment is an explicit recommendation about the type of program that is needed. And there are 3 potential types of programs that can be recommended. There are primary prevention programs. So primary prevention programs are programs for preventing the problem before it even occurs. So if you're trying to reduce pregnancies among teens, for example, you teach sex education is a primary prevention strategy to teach them about how to avoid getting pregnant in the first place. That's primary prevention. Then there's secondary prevention. So this is programs for the immediate treatment of problems. So they're short term. So we're not solving the big problem, we're solving an immediate need. So during the winter months, it's really cold and homeless people can die from exposure. So we have homeless shelters is a secondary prevention for dealing with the immediate short-term problem of winter and homelessness. So is there a long-term solution? Yes, we call those tertiary prevention. And so tertiary prevention programs target the long-term complications of problems. So for example, they'd be like job training for folks who are chronically unemployed. You recommend a program for job training to get people who are chronically unemployed employed. So those are the three major types of programs: primary, secondary, and tertiary. So the next type of evaluation research is an evaluability assessment. And I didn't even know this was a word. We did these, but we didn't. I didn't know there was a word for it. They're conducted on existing programs before you do some sort of outcome or summative evaluation. And you're just trying to figure out what's going on with the program. That's the goal of an evaluability assessment. So there was a program to give drive tests when the doctor, courts, or police referred persons for a drive test because they saw them driving erratically, but they weren't drunk. And one part of the evaluability assessment we did on that is like, who's getting these things and how many are we doing per year? It's when I was at DMV. And what are the important outcomes to measure to see if this program is actually working if we want to do that in the future. So that is an example. So it's kind of like a pre-assessment assessment. So you're going in there to figure out what a program is and what it's who it impacts and what it's supposed to do before you, and what you should measure before you actually do an outcome assessment. So you identify what are the program's objectives, what are the components, what are some appropriate ways we could evaluate it, some strategies for that, and you need to get the cooperation of parties for future evaluation. What are the goals of the program? So who are the people who are supposed to be served? Who are the stakeholders, the people who are affected by the program? And it's before, again, you start some sort of actual outcome or summative evaluation. What's going on with this program? That's called an evaluability assessment. So the end goal is to get explicit and measurable objectives that you can evaluate. So you wouldn't look at whether this thing improves traffic safety, but specifically it reduces the rate of motorcycle accidents. You have to operationally define things and come up with a way you will evaluate it so parties can agree on those definitions before you start a summative or outcome evaluation. So then there's program monitoring. So the next type. Program monitoring is also conducted on existing programs, and the goal of them is to determine how well things were implemented per original requirements. So it's supposed to do this, how well was that actually achieved? So ignition interlock programs for DUI offenders, for example, there was a pilot study in California where 4 counties, regardless of whether it was your first or your 10th DUI, you had to put an IID in your car. And so, the first part of our program monitoring of that is, do convicted DUI offenders, they're ordered to, but do they actually install them in their cars? And we found out things like, no, they sell their cars, or they transfer them to their kids' names so they don't have to install it. They buy a motorcycle because there isn't IIDs for motorcycles, those sorts of things they would do. And that was part of our program monitoring of how well it was implemented and how well it was working. So they assess how well programs conform to their plan specifications, how well they actually do what they were supposed to do in terms of being implemented. And so you identify differences between how it actually is and how it was supposed to be. And you adjust the program or its objectives. So this isn't working, you can scrap it, or you adjust things and make them work better. Like we made it so that if you got a DUI offense and you owned a car within X amount of time, you had to install one on any car you purchased or drove. So you conduct them on existing programs, and they are ongoing, so you can do multiple program monitoring evaluations. So we have program impact, and this is kind of where I made my mark in life. You conduct them on existing programs to determine if they had the intended effects. So this is a summative evaluation. The other ones so far were process evaluations. So did Head Start improve reading and math scores of young children from underprivileged households? That would be a program evaluation or a program impact evaluation. How well did the program meet its objectives is the primary question. You measure and you evaluate those objectives, and you evaluate side effects too. So yeah, this program worked, but it created this other problem or this bureaucracy or whatever it be. And these usually mean the life or death of a program. So if you evaluate it and find that it's not effective, can sometimes end up in a kill program. That's what happened with driver education in California, for example. They evaluated it using experimental design finally and found that it wasn't actually associated with reduced crash rates for teenagers, so they stopped funding driver training in high school. So finally, we have efficiency analysis, and this is cost-benefit analysis is what most people think of it. So you're looking at what is the benefit we get and does it justify the costs? And you compare the cost of the existing program to like other possible programs you could implement. So is it better to incarcerate people arrested for minor possession of marijuana, or is it better to send them to treatment? That would be an efficiency analysis, looking at what is more efficient. So is it worth it? Are there other programs that would be more cost effective if we were to consider them instead? So you look at different cost metrics, and there's two major classes. There's what we call cost benefit ratios. That's when you look at what is the cost per unit of benefit, and the benefit is in dollars. So it costs $200,000 to to save $2 million per year. That would be a cost benefit ratio. So not a bad one. There's also cost effectiveness ratios, and that's cost per unit of benefit when the benefit's not in dollars. So it costs $200,000 per person to avoid 1,500 crashes per year. So we've got our benefit not in dollars, right? It's in saved crashes, but those do translate to dollars, so it's kind of cheating. Finally, we have what's called the opportunity cost, and opportunity cost is you consider what we sacrifice in order to maintain the current program. So this is the whole comparing alternatives. So we spend this much money to do this, we therefore can't do this and this other thing, and you make those comparisons, and what is sacrificed is called the opportunity cost. So for example, the money spent to make remedial students average could alternatively be used to make average students exceptional. That's an opportunity cost of spending so much money on remedial students. So that is applied research in a nutshell. Again, if you have any questions, whatnot, put it in the discussion and I will do my best. Otherwise, I'll see you next term.